Situation with the pandemic in the US is getting hotter in a bad way recently. We once again broke records with a record number of cases in the US, also in the world. So once again, we are number one. But unfortunately, here is the thing about that right part of that chart that you're seeing, is that the situation facing our frontline workers is unfortunately looking like the first big rise up on the left part of that chart, even though it was months ago. For weeks now, nurses have been posting online testimonials about a lack of PPE, with some given surgical masks instead of N95 masks because of shortages. In a video posted last week, a Florida nurse said she breaks the oath she took to, quote, do no harm every time she goes to work without protection, and worries constantly she may be infecting her patients, coworkers, and family. This is not a limited thing. This is not just anecdotal. Demand for protective equipment has soared, but unlike back in March when efforts focused on getting PPE for major hospitals, especially in areas like New York, Detroit, and Chicago, supplies now are desperately needed everywhere. Primary care offices, nursing homes, prisons, psychiatric and disability facilities. As many states have continued to reopen their economies, demand has also surged from the construction industry and other sectors. With soaring demand, prices have skyrocketed. And so I recently had a doctor on and I asked him, what have we learned from the first time and how are we better prepared? And we are in some ways, but this is the same problem. You would think with months of time to prepare, we would take it seriously. We'd be prepared. But Trump checked out months ago. The funding has largely checked out months ago. And now, once again, these frontline workers, our heroes, remember, we were all calling them heroes, are now having to be heroic in the same way once again and risk their lives.
Yeah. You know, the thing about this moment that is most frustrating is the intentional actions and decisions that are being made by not just Donald Trump, but Republican governors across the country, and how irresponsible it is in that they are not only creating the conditions for us to forcing us to go back out, right? They want us to go out and consume, but then they're undermining anything that would help ameliorate the effects of this, right? We could have opened up the economy slowly but surely and carefully, but that wasn't good enough for them. What they've done is like saying, we want to open up the economy and create the very worst conditions imaginable. And that's where we see the increase, right? I think what was it, 60,000 new cases yesterday alone. And I'm just amazed at how sadistic this really is. Like, I can't imagine what's going through their minds, but I don't even care about trying to figure them out because it's all on purpose at this point. Whether it's ignorance, incompetence, or malevolence, the result is the same.
Yeah, or some weird stew of all three. We talked about yesterday on the show, Tucker Carlson, he's like, schools have to open. Also, they shouldn't be wearing masks. There's no science behind wearing masks. It's like...
give us something, right? Like stop. I mean, you're literally creating the exact conditions necessary to maximize the deaths. John, I'm sorry for cutting you off, but this is what I did my show on today. And it is really at the level of fury. They are literally creating the conditions that are going to get people killed when, if they did the right thing, we could get even better results, right? If they took the steps that are necessary, people could not only survive, but if we had virtual learning, kids would learn better. I mean, there's so many things that we could be doing and innovating around in this moment, but instead of doing the better thing, they're doing the exact thing that's going to cause people to get killed. And I don't know, man, something has to be done about this.
I agree. And also, don't apologize. I brought you on to cut me off. If you wanted to get kids and their families killed from coronavirus, what would you have done differently in that Tucker Carlson monologue? Nothing. You do that if your goal was murder. It's insane. You're not supposed to say it. You're supposed to be polite while they're trying to get people killed.
Right. What else are we supposed to say? That's literally what they're doing. And then if you add on top of it, right, the reason I'm so pissed off about it is because on top of this is the fact that none of their kids go to public schools.
Yes.
All of their kids are probably going to be homeschooled with a very well-paid, highly paid tutor to sit there and give them a first-class education while they are insisting on sending our children back out to public schools in situations where even on the best of days, schools are petri dishes. Like We haven't gotten sick since we started quarantining because our kids aren't bringing anything home from school. Every sickness we get in this household comes from school, and that's on the best of days. And these people who have no skin in the game, literally, Betsy DeVos probably doesn't have anybody in her generation that goes to public school, but she's demanding that we go back to public school.
Exactly. And the people who have the most skin in the game, we're leaving them out. Teachers, I already saw local news stories starting to filter up of teachers dying over summer school from coronavirus. There was a Texas case of that. In terms of these nurses, doctors, other people in healthcare, 94,000 infections, more than 500 dead officially. The actual number is likely much higher. And now we're telling them, no, you need to do without masks once again. And in interviews, White House officials say concerns about PPE shortages are overblown. They said U.S. manufacturing and stockpiles of protective equipment have improved dramatically and are adequate in most states. Oh, good. Well, then I'm glad for doctors and nurses in most states. But in a survey of 23,000 registered nurses, National Nurses United found 85% were asked to reuse masks designed for single use, and a survey of over 14,000 by the American Nurses Association found nearly 80% being asked to reuse masks and 45% reporting shortages. Still, after months, in the most powerful, richest country in the history of countries, they're still having to reuse masks and they're still running out of PPE. It is an embarrassment.
There's no excuse for it. There's literally no excuse for it. And while I hope that there is some journalist who's willing and has the stomach to actually investigate so that we can finally have a line between the stupidity that we're seeing, the how we have abandoned our healthcare workers, and we have no PPE. If they could draw the line to the cause and effect, we would appreciate that as a society. But for now, okay. Anyway, I'll stop there. But for now, they can all go to hell. Let's just stop there. Yeah. They can go to hell because what they're doing is killing people. And John, I will say this though. I wonder how much they expect us to tolerate. I wonder if they really feel like they can just get away with this without any repercussions whatsoever. Because, I mean, at this point, their decisions are directly harming us. And it's almost like a physical threat to our well-being.
Yeah.
And the question in my mind is like, how much do they think the people could take?
Yeah. Apparently at least a little bit more than we're taking right now. And I think a lot of people are probably right on the edge, if not past it at this point. Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.